The Ministry of Health has confirmed the death of one Mpox patient in Kenya. This marks a grim milestone in the country's response to this viral disease. The announcement made by Health Director General Patrick Amoth has revealed that the patient had pre-existing medical conditions. Our reporter Stace Kwesha with more details on this story.
Kenya has reported its first Mpox-related death as the Ministry of Health confirms a total of 13 cases nationwide. The victim, who had pre-existing health complications, was among the patients battling the virus. Health Director General Dr. Patrick Amoth shared that 8 patients have recovered, while 4 remain hospitalized.
For now, we have dedicated 4 laboratories to be able to do this testing, but we have redundant capacity of more than 100 laboratories if there's need to be able to call for additional laboratory support. Africa as a continent, we require 10 million doses of vaccines.
This comes as the government ramps up efforts to address both Mpox and neglected tropical diseases. The World Health Organization has donated over 15 million tablets to fight lymphatic filariasis, soil-transmitted helminths, and schistosomiasis, targeting high-risk areas in 15 counties. According to Caroline Jumwa, a medical researcher at Cambridge Wellcome Trust, symptoms of the virus typically appear within 7 to 10 days after exposure. She emphasizes that this is the maximum time frame for symptoms to manifest in most cases.
Therefore, it is important to know that when somebody gets exposed to a monkeypox virus, it takes 7 to 10 days for the symptoms to appear. Most of the time, the infection is self-limiting. However, there are instances where people get very sick and it can be fatal. Also, it is important to note that the skin lesions become wounds, hence exposing the skin to a secondary infection, bacterial infection. And therefore, it's very important to prevent secondary bacterial infection, as this can complicate the situation.
Health Cabinet Secretary Deborah Barasa has emphasized the role of community health workers in ensuring the success of this campaign, alongside plans to register households for the Social Health Insurance Fund to improve healthcare access.
Primary risk in contact with an infected person or contaminated personal items or through sexual contact is the common secondary infection that would occur in our country.
Kenya's health sector faces the dual challenge of curbing the Mpox outbreak and eliminating endemic diseases by 2027. Stace Kwesha reporting for Group 7.